Thailand has become an aging society with a higher prevalence of non-communicable diseases, resulting in higher numbers of elderly persons with visual impairment and diabetes. Universal access to high-cost medicine, off-label use of bevacizumab, เมตตาประชารักษ์ วัดไร่ขิง Hospital, นครปฐม Province. Retinal disease is an important health problem in patients, especially the elderly or older persons. The disease includes neovascular age-related macular degeneration, neovascular AMD, a major cause of the patient's severe vision loss in a short period of time and possibly blindness. Diabetic macular edema, DME, a complication of diabetic retinopathy. At present, the treatment of neovascular AMD and DME is provided by using anti-vascular endothelial growth factor, anti-VEGF drugs, which effectively inhibit vascular endothelial growth. Two widely used anti-VEGF drugs are bevacizumab and ranibizumab. Both drugs are produced by the same company and have similar drug action or pharmacodynamic characteristics, but they have different license indications and prices. 1. Ranibizumab has been approved for treating neovascular AMD, DME, and retinal vein occlusion with macular edema efficaciously. But it is very expensive, $1,490 per dose in 2011. As some patients need to receive many doses of the drug, the eye care spending is a financial burden for the patients and their families. 2. Bevacizumab is a drug in the anti-VEGF group, approved for the treatment of several kinds of cancer. In foreign countries, a report on the off-label intravitreal injection of bevacizumab first appeared in 2004 for effectively treating neovascular AMD and DME. Intravitreal bevacizumab is administered at a dose of 1.25 milligrams at only 0.05 milliliters, which is about 150 times less than the systemic dose used in chemotherapy. So the price of one repackaged dose of bevacizumab for intravitreal injection is approximately 40-fold cheaper than that of ranibizumab. The price of 100 milligrams of 4 milliliters of bevacizumab is around $540. So the cost for one injection of bevacizumab in the patient is approximately $23 to $33. Recent studies on drug efficacies and relevant factors contributed to the access of anti-VEGF drugs have shown that the off-label use of bevacizumab is widespread. However, there has been limited Phase 4 clinical trials, post-marketing surveillance, to monitor the safety of both drugs. In Thailand, only the patients under the Civil Servant Medical Benefit Scheme, CSMBS, and the benefit scheme of state enterprise employees can get reimbursed for the drug expenses on ranibizumab. Thus, to increase the access to such a drug and create equality for the patients under the Universal Coverage Scheme, the Health Intervention and Technology Assessment Program, HITAP, and members of the Thai Retina Society, which is a part of the Royal College of Ophthalmologists of Thailand, have conducted a systematic review and meta-analysis of the use of bevacizumab in treating macular diseases. Dr. Paisan Ruamviboonsukh, the president of the Royal College of Ophthalmologists of Thailand, said, "The systematic review and meta-analysis study has shown that the efficacies of bevacizumab and ranibizumab in treating neovascular AMD and DME are not significantly different, and both medications are more significantly efficacious than the standard laser therapy. Based on a meeting with stakeholders, including ophthalmologists, academicians, and representatives from the Thai Food and Drug Administration and the pharmaceutical industry, there are 3 policy recommendations to the Subcommittee for Development of the National List of Essential Medicines, NLEM, as follows. 1. Conduct price negotiations for ranibizumab so that its price is close to that for bevacizumab, taking into account the same amount of drug in a pre-filled syringe, or to the price levels that the Thai health insurance funds can afford. 2. If the prices cannot be negotiated, bevacizumab should be selected for inclusion in the National List of Essential Medicines. 3. Establish a post-marketing surveillance system for the patients who have received bevacizumab to obtain a monitoring system of the serious adverse effects and discontinue drug use in a timely manner. According to the scientific evidence and the health benefits for broader society, on August 7, 2012, the Subcommittee for Development of the National List of Essential Medicines issued a notification declaring that bevacizumab is a medicine in Category E2 of the NLEM, whose indication is for the treatment of neovascular AMD and DME. As a result, a large number of patients under the Universal Coverage Scheme have had access to the medicine. In this connection, a drug monitoring system has been set up in line with the conditions for the use of the medicines in Category E2, and a research study is to be carried out on the drug's effectiveness and safety. Dr. Suwit Wibun Prasert, former chair of the NLEM subcommittee, said, "We work in the public sector for the benefit of the public. Faced with resource constraints, we are required to choose things which are important and will provide the most benefits. This is what priority setting means. When we maximize benefits, it should be for the benefit of the population. Since taxpayer money is used, they should be the ones to benefit the most, both in terms of equity and efficient resource usage." Here is Metta Pracharak, Wat Rai King Hospital, located in Sam Pran District, Nakhon Pathom Province. The hospital specializes in ophthalmic services and handles a large number of patients each day. The hospital's pharmacy division has developed a system for repackaging drugs for intravitreal injection in a cytotoxic clean room. Particular attention is paid to the repackaging of bevacizumab using the aseptic technique prior to injecting the patients. The repackaging of bevacizumab is to be done in such a way that, out of 4 milliliters of the drug in a vial, each pre-filled syringe for one injection contains 1.25 milligrams per dose. Dr. Wong Siri Tawi Banjongsin, vitreoretina specialist, Metta Pracharak Hospital, said, "As bevacizumab has been included in the National List of Essential Medicines, the patients under the Universal Coverage Scheme barely pay for the treatment. The doctor feels very comfortable to prescribe and use the drug in treating the patient effectively. In this regard, they have to trust that the drug repackaging and preparation processes are performed according to the established aseptic technique." However, although there has been a policy on equitable services, other components of the service system have to be developed simultaneously. Dr. Warapat Wongsawat, head of the Retina Division, Metta Pracharak Hospital, said, "In the next stage of program development, there must be national standards for drug repackaging, which must be verifiable. To reduce the overcrowding of patients at a certain hospital, Other hospitals that are ready to do so should do the drug repackaging by themselves. The logistic system of such drugs from the repackaging sites to peripheral hospitals, or those that are unable to do their own repackaging, needs to be operated according to the established criteria or standards for all steps in terms of quality, transportation, inspection, and safety control. Sombat Tangjan and wife, patient under the Universal Coverage Scheme, said, "We are rice farmers with not much income. If we had to pay for medication and continual treatment, we would have been in trouble, and we would not have received treatment. And if we really had to pay, we had to sell our paddy field to get money for curative care. Luckily, we were eligible for medical care under the Universal Coverage Scheme, so we did not have to pay for such treatment. We actually paid only for transportation. Today, with good willpower, we can work as usual and have a better quality of life." Sipai Tep Yunyong, patient under the Universal Coverage Scheme, said, "Our family's status is not so good economically, living on income from our only daughter. My husband is chronically ill and is unable to work. I also suffer from diabetes, kidney disease, heart disease, and blurred vision in both eyes. The doctor at Bang Plama Hospital in Suphanburi province transferred me for further treatment at Metta Pracharak Hospital, which is about 100 kilometers away. Luckily, I did not need to pay for any medical care. That has relieved our daughter's financial burden tremendously. If we had to seek money for the treatment, we had no idea from where we could get it. At present, I can barely work, as I am also suffering from several diseases." Studies or reviews of bevacizumab's effectiveness and safety have shown that the drug that is used off-label is really efficacious, resulting in the setting of evidence-based policy to include the drug in a suitable system that is for the benefit of elderly persons and diabetes patients who will have access to a safe drug and more curative options. This research has led to the creation of equality for the patients under the Universal Coverage Scheme. The results have immensely impacted the medical system at the international level, as there has been important information for other countries to consider in setting their own policies on the treatment for patients with neovascular AMD, DME, and other macular diseases. Dr. Suwit Wibunpon Prasert said, "The inclusion of bevacizumab in the National List of Essential Medicines has increased the chances and options for patients through our post-marketing surveillance system to monitor the drug's effectiveness and safety. The patients and the National Health Security System are confident in the use of bevacizumab." Some people have the misconception that developing countries have no access to expensive medicines, that there is no need to conduct assessments or priority settings, because there is nothing to prioritize since we are poor. However, this opinion is wrong, because if we are poor and resource constrained, we must prioritize or we will not survive. The poorer we are, the more we need to prioritize and conduct research. If we prioritize well, we will have the necessary funds to conduct research and further develop our country. Former President Nehru of India said, "Because we are a poor country, we cannot afford not to do research, since research begets knowledge, and it is this knowledge that will lift us out of poverty."